how do you apply for Medicare? And that's what we're going to explain in today's video. So first, what is Medicare? Okay, Medicare is health insurance regulated by the government, and Medicare is for individuals that paid into it or if you had a disability. So if you're turning 65, you worked in the US for 10 years, 40 quarters, then you worked into the system, you paid into it, then you're eligible for Medicare when you turn 65. Now, if you was a housewife and you did not really work, it's okay. You can get Medicare through your husband's work credits, okay? You can also get Medicare from a qualifying disability, SSDI. So if you work enough into the system and you paid for Social Security disability insurance, then if something happened, you become disabled, you have a qualifying disability, you get SSDI. After 24 months, you will automatically get Medicare as well, and some other qualifying disabilities such as end-stage renal disease also qualify for Medicare as well, and for ALS. Okay, so if you have any of those disabilities, then you do qualify for Medicare. So now let's talk about how do you apply for Medicare. So the first way is getting Medicare automatically, okay? Say you draw Social Security at the age of 62, well, you're already in the system, so when you turn 65, you will automatically get Medicare. Say you got Medicare at the age of 65 automatically, but you're still working and you don't want Medicare, you can delay Medicare. You just have to let Medicare know that you want to delay it. Otherwise, you will have Medicare automatically, like I said, if you're already drawing Social Security, and of course, if you're drawing Social Security SSDI, okay? So that's how you get Medicare automatically if you're already in the system, if you're already collecting Social Security. The second way you could apply for Medicare is via ssa.gov. You would go online and create yourself an account. They will ask you a few questions about yourself to make sure it is in fact you, such as your name, your date of birth, your Social Security number, and such. Once you create that account, you could go ahead and apply for Medicare online. It takes about 10 minutes to go ahead and apply for Medicare Part A and B, okay? You could also call the Social Security office and set up an appointment to go in there in person and do the application as well if you don't feel comfortable doing it online, okay? So those are the three ways you could apply. Number one, automatically. The second way is via ssa.gov, and the third way is going to the Social Security office, okay? Now, when can you apply for Medicare? You have a 7-month window to actually apply for Medicare. You have 3 months before your 65th birthday, you have the month of your 65th birthday, and then you have 3 months after you turn 65. We highly recommend that you apply for Medicare 3 months before your birthday, so that way you don't have to worry about any delays. You know, Social Security can get backed up and all of that. So yeah, we definitely recommend that you do this 3 months before you turn 65, and it takes about 2 months for Social Security to process your application. Once they process your application, they will send you in the mail your red, white, and blue Medicare card, and you will see 2 dates on your card if you apply for both Part A and B. You'll see Medicare Part A on your card, which is your hospital coverage, and you will also see Part B on your card, which is your medical coverage. So Part A will be for hospital coverage. Also, Part A helps with, like I said, hospital, hospice, skilled nursing home care, and home health as well. Part B will cover your medical, your outpatient medical services. So services you're getting done outside the hospital would be Part B. So it would be going to your doctor, it would be getting labs, diagnostic procedures, certain tests, preventive care, IV medications. It would be for the flu, the vaccines, the COVID-19, all of that would be covered under Medicare Part B. Mental health services, ambulance, clinical research. So a lot of things do go into effect when it comes to Medicare Part B. You kind of need both hospital coverage and your outpatient medical coverage. So that's Medicare Part A and B. Now, once you enroll in Part A and B, you also need to go ahead and enroll in a drug plan, okay? So Medicare covers 80%, leave you behind 20%. So individuals would get on a Medicare supplement to cover that 20% and get a standalone drug plan, or you can get on a Medicare Advantage plan, and all of this is bundled with Part A, Part B, also known as Part C, which is the Medicare Advantage plan, and your drug plan as well. Okay, it's very important to enroll in Medicare Part B on time and to make sure you have drug coverage on time as well. Thank you so much for watching today's video. If you have any questions, please leave them in the comment section below. We'd be more than happy to answer your questions. If you need any assistance, give our office a call. We'd be more than happy to assist you. If you know anyone that needs help, share this video with a friend. Thank you so much for watching, and I'll see you on the next video. Ciao for now. Bye.